welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and I'm thrilled to have with me Dr. Candace Holmes. She is the CEO of BrainCore of Duluth. I want to make sure I have that right. And what they focus on is natural brain focus and attention specialist. That's what she does. And we've had so much fun. Candace, welcome to the show.
Thank you so much for having me. I'm glad to be here.
We had so much fun talking before the show started, and you were giving me some background on what it is that you do and how you got involved with BrainCore. So please tell us a little bit about BrainCore and your wonderful experience as a chiropractor.
Thank you. Yes, my degree is in chiropractic. So our philosophy is typically chiropractic first, drug second, and surgery last. My daughter was diagnosed with ADHD when she was 7. Her younger sister is gifted and accelerated, and she was struggling in school. She was socially awkward. She lacked focus and attention. Honestly, it was a nightmare because I had already been divorced for about 3 years prior to. And so, honestly, I was in denial about the diagnosis. I thought it was too broad, and I just thought the doctor just put that on a child just to give it a label. So one day I was going through one of my chiropractic magazines and found an article that said drug-free therapy, non-invasive, with results that can last up to 30 years. And I'm thinking, what is that? And so that's how I found out about BrainCore. Found out that it is co-founded by one of my former chiropractic professors who is looking for a solution for his nephew who has autism. And so since he taught me, I knew that he did his research and he knows this stuff. And so I got trained in the therapy and bought the system back just for my daughter. I honestly didn't care about anyone else. And she had such a wonderful transformation after BrainCore therapy that I just decided to help others.
Wow. Okay. So many great things coming out of this. All right. So I'm so curious, if you don't mind revealing a bit more. When you're talking about ADHD and anxiety and depression, this is a real big problem going on in our country. And I bet you it's always been around. Of course, it's always been around. But what's so nice about the younger generations, millennials and Gen Z, is that they are more apt to talk about it, which is very healthy. I love the fact that people are more self-aware. And, I have my best friend is actually working on an advanced degree where she is working with kids who have dyslexia and other neurodivergent challenges. And I've been listening to her talk about how a lot of women are misdiagnosed. They don't recognize that they are a very high functioning autistic or ADHD or somewhere on the spectrum, and that ADHD and autism, they're all connected. It's just interesting. And if I'm watching my TikTok feed and I'm seeing so many different things about it. So how does your business help people without the use of medication, and also with being able to last for 30 years? That's fascinating.
Yes. So neurofeedback is a sophisticated form of biofeedback. So this technology has been around for over 50 years, but it was only in those prestigious institutions like UCLA and the Mayo Clinic and Harvard. So as with anything, technology gets better and the systems are more user-friendly. So now people like me can offer it to everyday people. So like you said, I'm so thankful that people are more apt to focusing on their mental health instead of it being a stigma. They're more apt to talk about it. And I'm just thankful that I can provide a service for children as young as 5 years old. My oldest patient is 84. So there's a broad spectrum. The brain is able to learn new ways of being. That's where the neuroplasticity comes in.
Oh, for sure. And you're absolutely correct. That neuroplasticity is phenomenal, isn't it? How you can retrain your brain after an accident, how you can retrain your brain if you're performing poorly in school. If you're easily distracted, you can retrain. I have a friend of mine who wrote a book on neuroplasticity, and it's just fascinating. You are in such an amazing field. I mean, thank you, daughter, right? thank her for getting you into this.
I'm so glad you said that, because it was hard. And being a single divorced parent, I understand the struggles. That's one of the things that sets me apart from other people is some people, like the psychologist that diagnosed my daughter, is a sorority sister of mine. And we went on vacation together, she and her husband, her daughter, me and my 2 daughters. And when the girls were put to sleep, we were sitting there watching television, and they're like, "Oh my gosh, Candace, how do you do this? Like, we didn't realize how much redirection it took. And you constantly have to tell her how to do this, and you're monitoring her and doing that." And I'm thinking, my gosh, especially the psychologist, like, you deal with this every day. But then I realized when she goes home, her daughter doesn't have the same challenges. So she doesn't get it. I said, you only have her for 1 hour of the day. I have her for the other 23. So that's the part that I really connect with my parents and my patients, even the adults who, knew that something was a little off. I have a lot of people who do not like the way drugs make them feel, loopy and just not themselves. I had a 15-year-old patient who told his mom, "Look, I'm tired of feeling like this. We have to do something." And he's the one who found me. So just thankful that, like you said, the younger generations are more aware, and they are willing to try what people call alternative. Natural. It's just natural.
I'm so proud of you. And you give hope to so many people. So now tell me a little bit about your business, your region, your territory, because, we were talking about how your business has different locations around the globe, right? Or is it just United States?
Correct. Around the globe. So one wonderful thing about BrainCore is that BrainCore Systems is the parent company, and there are different regions that practitioners live in. So one thing I love about that is we now have home units. So I can work with anyone in the United States. Had a patient who was in Germany, and unfortunately there's no one in Germany that I can send them to do the initial mappings and things, the brain mapping. So I was a little bit disappointed in that. I called headquarters. I'm like, "Nobody's in Germany yet?" They're like, "No." I'm like, "Oh, I need to open a branch in Germany." However, that's one thing I love about it, because you can perform this therapy at home. So in the convenience of your own home, according to your own schedule. I mean, we're all busy. I mean, and this is Atlanta. No one wants to drive, 3-4 hours, right, 2 or 3 times a week. As opposed to just going to your home, open up your laptop and starting a therapy.
Oh my goodness. Okay. Well, much success to you. Okay. I really want to thank you for being here with us, Candace. I mean, you've been amazing. So everyone, thank you so much for joining us on today's episode of Ask the Doc. If you want to find out more about Dr. Candace Holmes and her business, BrainCore of Duluth, please do, and visit Buzz TV at iwannabuzz.com to learn more about her business, and how, if you have someone in your life who could use some training and getting over anxiety and general health and doing it naturally, please contact her. That's amazing. Thank you so very much, and you have a wonderful day. Bye.